I'm Kunkel, a plastic surgeon in Fort Worth, Texas. Let's learn about how we do lower body lift surgery. We're going to change this woman's contour from this to this, and from this to this. I want to show you the concepts of how this is done. But first, let's learn a little about our patient. She's 44 years old, 5 feet 3 inches tall and weighs 151 pounds, and she lost about 50 pounds after a gastric sleeve procedure. We'll start with her front, what she sees in the mirror. She has a lot of loose tissue because she's lost so much weight. Let's take a look at how we removed this extra skin and tissue. On the front, we're going to make incisions, about like this. We'll make an incision around the belly button to separate it from the skin, but we'll leave the belly button right where it is. We'll remove the skin and tissue between those incisions, then we're going to pull the upper skin edge way down to the lower skin edge. This will result in a lot of tightening in an up and down direction. But this patient also has this area of laxity, and this is more of a side-to-side looseness. Because she wants to have as much loose skin and tissue removed as possible, we're going to have to do something extra for her. We're going to make incisions about like this and remove the extra skin between those incisions, and then we're going to pull all those skin edges together. It should result in scars about like this. Now let's check her actual result. Here she is 6 months later. How we manage the loose skin and tissue on her side is the same but a little bit different. We're going to extend incisions from her front to around her side and onto her back. Remove the excess skin and tissue from between the incisions. Then we'll pull the lower skin edges up to the upper incision line. Since on the front, we pulled the upper incision down, and on the side, we're pulling the skin edges up. Her final scar should end up about here. Let's see how she actually did. Now, let's look at her back. She has some looseness. To remove as much of the loose tissue from her side as possible, we need to also remove some tissue from her back. We're going to make incisions, remove the loose tissue, and pull the skin edges together. Like on her sides, the lower skin edges are pulled up. This should result in scars about here. Let's see how she did. Here she is 6 months later. That's how we did this woman's surgery. We'll do it differently on different people depending on their findings and desires. Now, let's review her before and after photographs again. Body contour surgery can provide amazing changes. We'd love to see you in our Fort Worth office. Come visit.